Tinnitus is that sound which you get in the ear in the absence of any external stimulus. When I speak and you listen to me, that is normal because you're hearing a sound that is being produced. It is a sound which is produced by the ear itself. The quality of tinnitus can vary depending upon its amplitude or its frequency. And so patients may have tinnitus that is like whistling sound, or like the sea sound, or like the sound of crickets. Sometimes tinnitus can be pulsatile, like a pulse is beating inside your ear. Sometimes it can be the sound of bees or pressure cooker. So tinnitus sounds vary depending upon the nature of the pathology and how the patient perceives it. And amplitude is the volume with which you hear the sound, in which case tinnitus may be mild, which is it is hardly perceived, or it can be very, very loud when the patient perceives a very loud sound in the ear, and that of course is more disturbing. Tinnitus is caused by many diseases. Most of the time we do not know the cause of the tinnitus. We do not know why the patient has suffered from tinnitus, but there are some known causes. The commonest cause of tinnitus in the current situation is exposure to loud sound. Particularly if you go to some function where music is being played loud, like a DJ function or some loud music function, you may hear sound at a loud volume which causes tinnitus. Sometimes people listen to music through earphones at a very loud volume, and that can result in tinnitus. Tinnitus can also sometimes be caused by some drugs like aspirin, diuretics, quinine, exposure to anti-cancer drugs, and some other drugs can cause tinnitus. Tinnitus can also be caused by various inner ear problems. Tinnitus can be caused by tumors inside in the head as well as around the ear. Tinnitus is also caused because of some muscular or myospasms. Tinnitus can be caused by diseases in the temporomandibular joint, vascular malformations, as well as some other diseases which stimulate the inner ear hair cells and cause a subjective sensation of sound for the patient. Sometimes an observer can hear tinnitus. This is particularly true of vascular malformations, and also if there is a sound of the cochlea which is visible. Tinnitus can sometimes be heard by the observer. This can be if there is a problem related to the temporomandibular joint, if there is a vascular malformation, or if on auscultation the doctor or observer can hear some sound which the patient is also experiencing. Though difficult to treat, tinnitus is not untreatable. As our understanding of tinnitus has improved over a period of time, we have realized that many patients can learn to live with their tinnitus, and many patients with tinnitus can have that treated by applying ourselves to a proper diagnosis and giving appropriate medical therapy or some kind of therapy which is related to tinnitus retraining therapy. Most of the time patients of tinnitus will have to undergo basic investigation like an audiogram. In an audiogram we will find out whether the tinnitus is associated with the hearing loss or there is no hearing loss associated with the tinnitus. In that particular audiogram we will also find out what is the frequency at which the tinnitus happens, and we will match that frequency with the amplitude of sound with which the patient experiences the tinnitus. That gives us a broad idea about how bad the tinnitus is and maybe a probable cause of the tinnitus. Treatment. In the treatment, the most important thing is to stay away from loud sound and to avoid drugs that are causing the tinnitus. There are some medications also that we give. There are some drugs and medications that help to relieve your tinnitus, and that can be given after consultation with the concerned specialist. If nothing works, we can also have a tinnitus retraining therapy session in which some pleasant sound is created and passed on to the ear of the patient. This creates a pleasant association with an outside sound. In tinnitus retraining therapy, also called TRT, patients are retrained to learn to live with their tinnitus so that the negative connotation or the negative feedback loop that develops in the patient's brain is eliminated, and the patients learn to tolerate their tinnitus and to accept it much better.